The duration of lockdown has been shown to be directly proportionate to the worsening of blood sugar control and diabetes-related complications. The effect on chronic disease management, either postponed or cancelled, can be serious for people with pre-existing medical conditions such as diabetes, heart disease and asthma, as they're more vulnerable to becoming severely ill with COVID-19 virus. Well, joining us now on the importance of maintaining good blood sugar control during this pandemic is Endocrinologist Dr Daksha Jivan. Doctor, good afternoon to you and thank you for joining us.
Hi Lundy, thanks for having me on the show.
I'm interested in finding your perspective. Would you say we've seen a drop in diabetic patients getting the appropriate medical care since the COVID-19 pandemic started?
Yes, I agree that that's happened. So lots of people, lots of diabetic patients and other patients are afraid to come into hospital at this time because they are afraid that they might be more prone or catch coronavirus, and therefore they might not have come into hospital to collect their medications.
I mean, we've heard it over and over again over the last couple of months since we've been on lockdown, but how important is it for patients to receive the correct treatment, especially in a time where there's skepticism, as you've said, around going to the hospital?
All right, so it is extremely important, I must agree. So the first thing that patients need to be aware of is that patients with diabetes, and especially poorly controlled diabetes, are at slightly higher risk of developing coronavirus. Now what happens is diabetics are immunocompromised, especially if they're poorly controlled. So if there is a time where they need to make sure that they take their medication, now would be that time.
I mean, I know a lot of people who have diabetes would have some sort of, schedule in place where they know if I go to work, I'm having my medication there and I'm having a meal there that's healthy for me. But with that out the window, a lot of people working from home, how can people who have diabetes still keep their blood sugar levels on par and still stay with their treatment on track?
Okay, so firstly, they need to ensure that they're collecting their medications. So that's the first thing. The other thing, especially for patients on insulin, is that they need to eat regular meals. So every 4 or 5 hours, they need to have either a small meal or a snack, and this ensures that sugars don't go too high or too low, so that avoids too much of variability.
How at risk would you say diabetics are in contracting COVID-19, and how much more serious is it compared to a non-diabetic person?
All right, to address the first issue, so epidemiological studies are not really showing that patients with diabetes contract coronavirus more frequently. However, having said that, even though the epidemiology doesn't show it, we have quite a lot of evidence to show that patients with diabetes are immunocompromised, and therefore they need to be more cautious in avoiding the disease. Now, what we have seen from the studies so far worldwide, from China, from South Africa, from the US, is that patients with diabetes are seen to have more severe disease. So, for example, patients with diabetes are 2 or 3 times more likely to develop a severe form of the disease. So they're more likely to require admission to intensive care, they're more likely to require ventilation, they're more likely to die from coronavirus if they already have diabetes.
Sure. I mean, Doc, just on the issue of people with the diabetes not going to collect their treatment, which is so important, as you've said, do you think provision has been made to assure these people that, yes, when you do come to our facilities, especially if it is a public health facility, that you will be safe? I mean, on a day-to-day basis, we're reporting about a lack of PPEs and nurses who, are up in arms about not being protected themselves in the workplace. Is it really unreasonable for people not to fear going to these public facilities? And how do we assure them that this needs to be done and they will be safe?
So what we've done, I work at one of the public hospitals, and what we have done is we have made absolutely sure that we have written prescriptions. So if anyone arrives, even on the patient's behalf, to collect medication, that script will be available for collection. If they need attention and they need to be seen at the clinic, we have also ensured that there is some social distancing in place. So instead of them all sitting together in the waiting room, we have tried to ensure that there is availability, there's more space. They would not come into as close contact with each other.
And just as we wrap up our conversation, your tips to some of our viewers: what should diabetics do to maintain good health during the pandemic and when access to medical facilities, as we've spoken about, isn't as high as usual?
Okay, so firstly, the general things. Patients with diabetes should exercise social distancing, they should wear their masks, they should avoid social gatherings. Avoidance and preventative care is most important. Secondly, they must not stop taking their diabetes medication. Go and fetch medication, make sure it's being taken regularly. Thirdly, eat healthy meals. We want them to eat their vegetables, we want them to get good nutrition. And fourthly, if they have the means to measure their glucose levels regularly, that is important to ensure that they are well controlled.
Absolutely. Well, thank you for those tips and thank you for your time. That's endocrinologist Dr. Daksha Jivan speaking to us about what diabetics, people living with diabetes, can do during this time of this pandemic to keep healthy and safe.